Hello everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about earache. Earache is a very common problem. 30% of the children will have earache before the age of 3 years. This earache occurs because the eustachian tube which connects the throat, nose and the ear is straight in children. So it's very easy for milk and food particles to enter the ear, for the pressures to become unequal and for pain to occur. This is aggravated by parents. They feel, oh, I'm too tired to sit up all the time and feed this baby. So even a breastfed baby is fed in the lying down position. Milk very easily enters the ear in this position. The same with bottle feeds or with the use of pacifiers. Sometimes children are very stubborn and they refuse to eat their food. So the parents force them onto the ground in a lying down position and then start feeding them. Food, as the child struggles, the food enters the eustachian tube, causes infection and pain. As soon as children start school, they are exposed to bacteria and viruses from other children who bring it from their families. So they share these bacteria and viruses like they share food, and ear infections are very common. Sometimes the adenoids or the tonsils are enlarged and big in children, and if they cause ear infections more than 4 times in a year, then it may be time to consider surgery. When a child has ear infection, they don't always have fever. If you feel that the child is hot, please check the temperature. It should be more than 100.4 degrees to be a fever. Earache, a child may not be able to tell you that their ear is paining. They may just cry, be fussy, start vomiting, and then start refusing to take their food. But if you pull or tug on the ear, or the child pulls on or tugs on the ear, there may be severe pain, and then you have arrived at a diagnosis. If you take the child to the doctor, they will ask you to apply nose drops. Please don't say, why should I put drops in the nose when the pain is in the ear? This is because nose block aggravates the pressure difference between the ear and the nose, and then there is severe pain. So if you decongest the nose, the ear pain will improve. Then you can apply ear drops. There are anesthetic ear drops which will reduce the pain. Antihistamines will reduce the secretion, and paracetamol and will reduce the pain. Usually ear infections clear up within 3 days, but if there is a bacterial infection, antibiotics may be needed and it may take longer. Frequent ear infections can be prevented with proper immunization with the H. influenzae, pneumococcus and the flu vaccines. Please remember to immunize your children regularly. It is not just children who get earache, adults also get it. But before you decide that you have a earache and start putting drops in your ear, open your mouth and see if you have caries teeth, or if your wisdom tooth is erupting, or the pain is actually in the jaw, so that when you open and close your mouth there is pain and it is an arthritis of the temporomandibular joint. Sometimes in children, when they go swimming, water enters the ear. Same thing happens when parents shampoo the hair, water and wash the hair. To prevent this, you can wear a shower cap which is available in the baby shops, which prevents water from entering the ear. You can also dry the ear using a hair dryer, but please remember to hold it at a distance and not too close to the face. If ear infections are untreated, neglected and allowed to recur, they can spread to the brain and to the bones behind the ear, and the child can lose hearing, lose balance and be chronically ill. In order to prevent ear infections, please decongest the nose with nose drops as soon as there is a nose block or nose infection, and take steam inhalations. This will clear all the nasal passages. This is Dr. Gita Mathai signing off. If you liked what I heard, please subscribe to my Health Vibes channel and press the bell button. Stay healthy, stay happy, keep everybody around you healthy. The same content is available in Tamil. Thank you.